So you met with the dentist today. Do you have any questions about anything?
Yes, he told me that I might have gingivitis because of my painful gums and inflammation, and also because they're bleeding, and I wanted to see what you recommended.
So we actually have a prescription here that he did recommend for you to use. It's called Chlorhexidine gluconate oral rinse. He prescribed it to help treat your gingivitis.
Okay, and where exactly does that apply to in the mouth?
So you're actually going to be using a capful of the mouth rinse, and you'll be using it as he directed. So here I see that he recommended that you rinse 2 times a day, in the morning and in the evening, for 30 seconds. It's going to actually hit your entire oral cavity, so it'll hit your gums and your teeth and everything. You don't have to apply it to one specific area.
Okay, great. And are there any advantages to this or any disadvantages?
So the Chlorhexidine gluconate oral rinse helps treat gingivitis, and it helps maintain a healthy gingiva, and it also helps control plaque. It can cause brown staining, so we do recommend a really good hygiene. So make sure you're continuing to brush your teeth well and flossing well. And it also can interfere with the taste of your foods. Some people report a little bit of a sour taste, so we recommend that you eat your meal first, and then you can use the oral rinse.
Okay. And I also wanted to know if there's any contraindications that I need to know about.
So as we discussed in your health history, you are not pregnant, but if you were or you're planning to become pregnant or breastfeeding, those are some contraindications. Also, if you have any allergies to the ingredients in this medication. We also don't recommend it for individuals that have crowns or caps made with glass ionomers or composites, but I see here in your chart that you don't have those, so we are going to be able to use this. It does use a bacteriostatic and a bactericidal mechanism of action, so it helps inhibit the bacterial growth as well as killing the bacteria. So the chlorhexidine gluconate is actually the active ingredient in this.
Okay. And also, are there any limitations?
So the mode of action does not actually remove any plaque or buildup that is currently on your teeth. Okay. So that is still going to require good oral hygiene. Mm-hmm. This just helps anything from further happening. It also reacts with anionic surfactants found in toothpaste, so it can reduce the activity of this agent. So we don't recommend doing it immediately before or after brushing your teeth.
Okay.
Also, it is more valuable as a preventative measure. So again, it helps inhibit growth and killing bacterial growth, but it won't remove anything that's already there. And okay. It must be used under the provision of a dentist because it is prescribed. You can't get this over the counter here in the United States.
Okay, that sounds great.
If you have any other questions, please call us. We're here for you.
Okay, thank you.
Thank you.